Oh, you guys are back. Oh, sorry. Don't mind me. Most important thing that I want to start with today is that urinary tract infection is not a sexually transmitted infection. It is not. However, it is worthy of note that poor sexual practices during intercourse can also lead to urinary tract infection. Ah, I know in your brain until you're starting to confuse us. So
May God not allow them, make them kill you.
relax. This is a slow day. So I'm going to take it one after the other and I'll make sure that you understand this thing perfectly well. Fine, we're going to start with what is urinary tract infection. Good, you've been hearing of it before. So now there is a picture that is going to appear showing you what we call the urinary tract. So I'm going to start from the lowest part, which is your urethra. So that is the urethra. Then above it is your bladder. Then if you go a bit above, then you see your ureters. And then after that, you see your kidneys. Guys, that is the urinary tract. So what is urinary tract infection? If that tract I just showed you now, if it's harboring an organism, that tract, the way it has been created, it's not meant to have any organism, be it bacteria, be it virus, be it fungi, or even parasites. That place is supposed to be sterile. If you start having any organism, then you're bound to have urinary tract infection. So studies have shown that 20% of women at least once in their lifetime will have urinary tract infection.
God have mercy upon us.
So auntie, wherever you are listening or watching this, stop blaming yourself or stop beating up yourself that you have a urinary tract infection. Be seen both in men and women. Yes, of course, it can happen to both man and woman, okay? But today, we are going to be very specific about the women, okay? So what are the causes of this urinary tract infection? Good. So just like I told you, organisms, you have bacteria causes and you have fungi causes. These are like the common ones that we see. But there's a bacteria we call Escherichia coli, E. coli. So that particular bacteria gives at least 70 to 95% of urinary tract infection. So you see, most times when you suffer from it, it is most likely that bad boy that is causing it, okay? So now, what are things that have led to you having that urinary tract infection? Number one is poor urinary practices. What do I mean by poor urinary practices? Auntie, make sure that if you are pressed, go and urinate. Stop holding urine. Stop saying that, let me just hold this urine. Then another cause is poor sexual practices. What do I mean by poor sexual practices? After sexual intercourse, you do not go and urinate. Then you start having these problems. Urinary stones. If you're having stones, yes, most likely you will be predisposed to what we call recurrent urinary tract infection. At least avoid any genitourinary manipulations. What do I mean by genitourinary manipulations? Passage of catheter for a very long period of time without going to your doctors to make sure that they change it and make sure that you're okay. Like the common causes are things that can predispose you to having urinary tract infection. So somebody will ask me, how do I know if I have this particular thing? Good, there are symptoms that you see or you experience, and then you know that you're having a urinary tract infection. So we're going to start with urinary urgency. What do I mean by urinary urgency? You stay for a small period of time, you start feeling the urge to urinate, and then you'll be running as fast as you can. Before you reach the toilet, you've already urinated on yourself. Yes, that's urinary urgency. Urinary frequency. If you're somebody that urinates normally maybe 6 times in a day, you find yourself urinating 10 times in a day, and then probably you find yourself urinating at night more than twice without taking so much fluid on a normal day that is no cold weather and you're not on any drugs, but then most likely you have a urinary tract infection. Okay, so another thing is if you see blood in your urine. When I mean see blood, it's not when you're menstruating. No, you're sure you're not menstruating. Okay, you're sure you've not had a miscarriage or whatever, and then you look at your urine and you're seeing that your urine is red. Please try and see your doctor. If you're noticing that your tummy, your lower tummy, is always paining you, and even when you're urinating, you'll be that peppery feeling if you're urinating, or you're having that sweet like kind of feeling if you're urinating. Other things you can feel is that if you're having what we call upper urinary tract infection, that is when this particular organism is located in your kidneys or your ureters. Yes, so you have pain, what we call flank pain. So this is your back now, you'll be feeling pain there or heaviness there. The thing you should do is to make sure you contact your doctor as soon as possible. Go to the hospital. Some tests will be carried out, especially some urine tests, and of course you'll be placed on the adequate drug. So somebody will ask me, okay, now doctor, you finish saying this, can't I just go and buy any antibiotics and start drinking it? After all, it might be a bacterial organism or it might be a fungal organism. If I go to the chemist, they'll mix drug. No, this is a very bad practice. You don't just get up and go and take any drug or any antibiotics because you feel that you have a urinary tract infection. That is a very wrong practice. You know why? If you keep taking all these antibiotics, most likely you're going to have what we call persistent urinary tract infection. That's as a result of resistance.
Why are you so stubborn?
The microorganism that is causing this has become resistant to a lot of antibiotics because you've been harming your body with a lot of antibiotics. And when this happens, it becomes much more difficult to treat. Okay, so I'll see you next time. Thank you. Have a nice day. Let me continue with my reading. Are you still here? I thought you've gone.